Welcome to the Life of Being podcast, where we talk about all things life from a healthcare perspective all around the world. I'm your host, Kelly Tan, and in each episode, we'll explore stories, science, and wisdom to help you live well, think deeper, and express life fully. Let's begin. Today, we are super excited to be having Dr. Jake Cooke joining us from the UK. Dr. Jake is a diplomat of the American Chiropractic Neurology Board and has a master's in musculoskeletal neuroscience. He's also the chairman for the European Academy of Chiropractic's Neurology Group. With his wealth of experience, he speaks and teaches practitioners internationally. His clinical work centers on chronic pain, dizziness, and balance disorder. Dr. Jake, welcome to the show.
Fantastic. Thank you very much for that lovely introduction.
I'm excited to dive into your story. And shall we start by you sharing your story in terms of how you got into chiropractic and also your decision and journey to being an expert in neurology?
So I went skiing when I was 14 with my dad, and we were being silly, and he bought some new skis and I wanted to try them out. So rather than going down to the mountain to the shop and having them actually fit the ski to my boot, I just clipped out mine, stepped into his and thought, oh, they fit pretty well, and off we went. And there was, of course, a black run that had been closed off for bad conditions. You know, why listen to the rules of the valley? So instead we went underneath the road, went skiing off, and partway down my one boot slipped out the ski. I went shooting off the piste, and unfortunately there was a broken tree branch down at ground level and it went into my leg. So it missed my kneecap by about a centimetre and hit me in the muscle. And then I carried on going and basically was off in the woods. My dad didn't see me, went skiing off down the mountain. I was ahead of him, again being a stupid teenager going too fast. And basically long boring story. Eventually got off the mountain, had to have a bunch of stitches in my muscle, had to have physiotherapy. And I thought I was already kind of aware that was maybe an area I wanted to go into. The physio was fantastic. Went to and then that led to work experience, and I went to the local hospital, did work experience there, and just felt it wasn't the right fit for me. And then my dad was seeing a chiropractor, and my sister was seeing a different chiropractor, and I went to go and observe them, and they were just really just full of energy, full of life, loved their work, and just kind of jumped into it from there. And then when I came out of university, I was quite lucky. Neurology was already my subject at university. I realized that was the one that I enjoyed the most. And when I came out of university, worked for a year, found myself getting a bit fidgety. And Professor Carrick from the Carrick Institute, the obviously founder of that, was coming over to the Netherlands where I was living at the time to teach in person. And I was just very lucky that my boss at the time heard about this and said, hey, you like neurology, you should go and do some CPDs, some continuing professional development. But it was, I remember literally sitting at the back of this seminar, 95% of it went all over my head, but I just knew this was it. So went back to the train station, and it sounds super dramatic and a bit of a cliche, but I remember just sitting with this huge sense of relief of like, that's the path, I can see it. And I remember literally it was a Dutch cloudy grey day, and the clouds parted and this beam of light came down, and I was like, okay, if you ever wanted a sign that
Wow.
that's the right path, then cool, this is it. And then that's been the way it's gone ever since.
So with your experience that you have, what sort of advice you would give to people who experience dizziness and also the balance disorder, and how would you differentiate the different types of them for people who don't know?
Yeah, so the first thing you need to do with any form of dizziness is you need to see a doctor. So loads of things can cause dizziness, and some of them are nasty. So the first thing we have to do is go and get a proper assessment. Don't try and self-diagnose dizziness. So it can come from your heart, it can come from your brain, it can come from your inner ear, it can come from a loss of sensation in your feet. There's so many different things that can cause dizziness. So the first thing is you go to your doctor, you describe your symptoms as best you can, and it can be overwhelming. So I would literally bullet point what are you trying to describe. If you don't have the words for it, then you watch videos like this, you go onto YouTube, you Google dizziness, and you watch how other people describe the symptoms, because a lot of people, when they first speak to me, they just don't have the vocabulary for it. And it's only once you start describing things to them, they start going, that's what it is. So write everything down, you go to your doctor and you say, this is what I'm experiencing, and you make sure that there's a proper assessment done. So usually that's always going to include blood tests, usually an MRI, brain MRI typically. That might involve seeing a cardiologist, that might involve seeing a neurologist and having nerve conduction studies in your leg. So it can be really diverse. It might just involve seeing a psychologist and having assessments for stress, anxiety, and depression. It really is a very wide list of things that can cause dizziness. So the first thing you do when you're dizzy is you go and see your doctor and you make sure all those assessments that look for nasty stuff are done, and then hopefully it's going to come back all well, I mean, I say hopefully it comes back normal. There's a bit of frustration that comes back with that as well. So kind of like, great news, it's not a tumor, but we don't know what it is a very frustrating thing to hear. But it's good news ultimately, right? If there's no sign of damage, then it just comes down to doing the rehab, which is obviously a lot better.
Would that route be feasible in, say, like the UK? They have categories, isn't it? If you're not urgent, then you'd be like waiting for months and months. So is that like feasible, or they'd have to go to the private route for them?
You're absolutely right. It should. It depends if your symptoms are genuinely worrying. The NHS and hopefully any country you're in will prioritize that. So you should have to test them down quickly. So obviously, if you present somewhere and we thought, oh wow, it sounds cardiac, then you should see someone really quickly. So you're right. The people who suffer, particularly here in the UK, are the ones where your symptoms are not that severe. You're not falling through the wall. Obviously your eyes aren't spinning in your head. You haven't gone deaf in one ear. Nothing like that. You just say, I just feel unsteady the whole time. Then yes, that can be a slow route by the NHS. And I think in most countries that have a universal healthcare system are all kind of struggling under the strain. So yes, it could be significantly faster to go private. You still want to have the same thing. So whether you see a chiropractor or a physio or an osteopath or whoever you choose to see, their job is still to say, take a really good history, understand all your signs and symptoms, do the best assessment they can, which involves looking at that neuromuscular skeletal system. So looking at everything from your eyes, your ears, your neck, all the way down to your feet, and then trying to rule in or out different conditions.
If someone just straight away comes to you, would you be able to do that, or you have to refer them to do all the scans and all the screening that I have to do with the hospital?
Yeah, I still have to refer out for like the MRIs and blood tests and things like that. So I can do all the neuromuscular skeletal bit. Then that's absolutely my
your expertise.
My skill. But yes, we still need, and when I'm teaching, I often say to other healthcare professionals, with these cases, you don't want to be the only person that's seen that person, right? So you don't want to be the only clinician with eyes on that case. You want to say, like, I'm really good at this bit, and I've done all this bit really, really well, but other clinicians have other skills as well. So let's just get a triangle in. So you have a few different people to make sure that you really have thought about everything that could be going on, because we all have our own bias, right? So if you're, classically, if you're a chiropractor, you might think it's coming from the neck, whereas if you're a nutritionist, you think it's it's vitamin D, it's whatever it is. So it's better for the patient to have a bit more of an honest conversation and say, like, I'm aware I've got a bias, and can we try to neutralize that as much as possible?
Yes. It's more on getting a team for them so that they can get the best result for their health, isn't it?
Absolutely.
Yeah. What is the most common myth or misunderstanding you have about dizziness and balance disorder that you want people to understand and you want once and for all demystify this?
I think the big one that does the rounds on social media is the idea that it's all coming from your neck. Now, I appreciate as a chiropractor that can sound a little bit anti the party line, but it's true. Social media loves the idea that any dizziness is all coming from your neck. And the reason that's a mistake is the majority of people with dizziness will develop neck pain and stiffness. So a lot of clinicians, patient comes into you and says, oh man, I'm really dizzy and my neck's really stiff and painful. And it feels very instinctive to say, those two must be cause and effect.
Yes.
Your neck is making you dizzy. But it's a little bit harder to see that relationship the other way around of, your dizziness is causing your neck pain. The reason that can happen, and the neck absolutely can be a driver, your brain is going to use your eyes, ears, and feedback from your body to control movement, balance, posture, and the neck is the main driver for that. So your brain is constantly saying, what did I see? What did I feel? So if I give you an example, if I'm looking at you now, Keely, and I jump my eyes to the right, my brain can see, if I feel my eyes move to the right, I can see my eyes move to the right, and I feel that my ears and neck felt no movement. But if I do this, I see exactly the same thing, right? But this time, my brain has to say, this time I can sense that my ears felt rotation to the right, my neck felt rotation to the right, but my body stayed still. And this looks exactly the same as this. This time my brain says, my ears still felt rotation to the right. This time my neck did not move, but so I must be in neutral, right? So you imagine there's an infinite number of combinations your brain has to cope with all day, every day. Did you move? Did I move? Did we both move? How much? How far? Are we on a boat? Are we on a plane? All that kind of stuff. Your brain has to use that feedback from your neck. So it is an essential part of balance. The bit that people tend to miss is that the deep muscles of the neck, we call them intrinsics, like the tonic system. Tonic means they're always on, right? So think of tone. They're being activated by your eyes and your ears and something called the reticular formation, which is like a diffuse group of neurons that are kind of pulling in information from all over the place. So if we just keep it simpler, we'll say your eyes and your ears are the ones activating those muscles of your neck. So you imagine if you have a dizziness thing where maybe the eyes are not moving as they should, or the vestibular system, your inner ear, is not working as it should, then the muscle activation in your neck is not as it should be. What you tend to see is some instability in the neck. Because your neck is now unstable, these tonic muscles that should have incredible endurance. If you think the weight of your head, pretty heavy. So if we took it off and put it on the side and weighed it, we'd say, okay, the head's like 4 or 5 kilos. It's pretty heavy. Even if you're really strong, if I gave you 4 or 5 kilos to hold and carry around, pretty soon you're going to say, I want to put this thing down. Hopefully you go your whole life without thinking about that with your head, right? In fact, the idea that your head has a weight to it is a strange feeling, right? Because it's so natural for us to carry it. So if those tonic muscles are not being activated properly, then your brain says, well, okay, I'm not as stable as I should be. And it starts to activate these more superficial muscles that we call either extrinsic, like external to the joint, or phasic. Phasic means they turn on and off. Think of like a light switch is phasic. So if my neck isn't very stable, I start recruiting all these phasic muscles. The problem is these extrinsic muscles, these phasic muscles, they don't have the same endurance. So they've got the power, they've got great power to lift and hold things for short periods. So like I said, if I gave you 5 kilo weight and said, bend your arm and carry this around for a while, pretty quickly your biceps are going to be screaming, so I want to put this thing down, right? Whereas your neck hopefully never does it. It's the same with these muscles. So now my neck gets very stiff, very painful very quickly. You have a massage, oh, that feels nice. The next day, oh, it's stiff again. So the mistake people tend to make is they develop dizziness or unsteadiness or vertigo or however they want to describe it. Dizziness really is an umbrella term. So dizziness could be 3 things. Lightheadedness, as it sounds, we tend to think more cardiac with that. I feel like I'm faint, I feel like I'm going to pass out. We think more cardiac. Disequilibrium, which means unsteadiness. Literally, you can't find your balance. Disequilibrium. And the last one is vertigo, which is a sensation of movement. Again, when people describe vertigo, they tend to mean spinning, but actually the definition is any sense of movement. That might be feeling like you're being pushed over or pulled over, or like you're rocking, bobbing, swaying, things like that. So anyone who has any of those brackets of dizziness will start to develop neck pain and stiffness. And so you can then start going to some kind of manual therapist on a regular basis. You probably do get some benefit, but it doesn't last very long. So that's probably the big mistake is people say like, oh, as long as I see my person, every 2 weeks, every month, every 6 weeks, then I'm good. But man, I had to cancel an appointment once and 6 weeks later, God, I was all over the place again. My neck was really sore. Whereas if we approach both at the same time, that's absolutely fine. But if you've got neck pain and dizziness and we know it's nothing, it's something like vestibular migraine or BPPV, or you've had vestibular neuritis, which is an ear infection, labyrinthitis, same thing, but with hearing loss. We want to always make sure we're saying we are definitely going to make sure that visual vestibular system is working properly, because otherwise the effects in the neck are probably going to be fairly short term. Does that make sense?
With the different types of dizziness and balance disorder that we have, would the approach or like the rehab will be similar, or that will be like quite specific to which type of diagnosis that they have per se?
Yeah, very specific. So some you can treat largely the same. So things like vestibular migraine, vestibular neuritis, labyrinthitis, 3PD or triple PD, they are often going to follow a pretty similar plan. But obviously if it's like POTS, like postural orthostatic tachycardia syndrome, totally different. So yeah, and if it was just purely neck, if it was someone who you think, wow, yeah, you had a whiplash and there's a cervical instability component, absolutely, totally different plan. You're going to be doing a lot of strength rehab and coordination rehab for the neck. So there are some fundamentals for vestibular rehab that are going to be the same through every program. But at some point, you're going to branch off and say, okay, and now we need to go more down this route and focus on these aspects. So let's say 3PD or triple PD, it stands for persistent postural perceptual dizziness. So persistent is there most of the day. Postural is mainly when you're upright and you're maintaining your own posture. So you feel better when you're lying down, you're supported. Might not be gone, but you feel better for it. Worse when you're standing up. And perceived is you feel like you're really dizzy. But often when people look at you, you look okay. So it's not like someone who's had an ear infection where they literally can't lift their head without, vomiting or the room spinning, where you think, wow, you look really dizzy. They walk and they're veering all over the place. Like, wow, you look really dizzy. Part of that, the triple PD is perceptual, which means you walk in a pretty straight line. You feel like you're all over the place, but when people are watching you, they're like, you look pretty good. So persistent postural perceptual dizziness, or perceived dizziness, sometimes they name it. So that is all about kind of visual dominance, that people using their eyes too much for balance. So they're really bad in supermarkets and busy crowds and anything with lots of visual stimulation, complex patterns on the carpet or on the ceiling or on the walls, things like that. So that you definitely treat different to someone with an ear infection. So they'll start probably with the same foundation, and at some point you start branching out and say, okay, now we need to be specific to what's going on with you.
Out of all the different types of it, which one will be the most challenging one per se that you've seen so far?
The hardest ones are probably Menieres disease. Research is not great great for vestibular rehab and Menieres disease. So we can't with any, if someone approached me with that, we can't with confidence tell me, yes, we can meaningfully change the frequency or severity. We can improve quality of life. So we can say we can improve your ability to complete your day-to-day activities. So you're not so reliant on others, so you not be so scared, so your anxiety can go down. But we can't say vestibular rehab will meaningfully change the frequency and severity. So that's a frustrating one to work with. Other challenging ones, MDDS, Disembarquement Syndrome.
Yeah, you mentioned that before to me last time.
Yeah, you're meant to say that with a French accent, but I butcher it every time. So I decided to stop trying to insult the French-speaking communities. MDDS is a challenging one too. So what happens in MDDS is so neurons in your ear, the vestibular system, they're always firing, always chatting away. So tap, 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 always chatting away. Let's say I lean my head to the right. The ones on the right side increase their frequency of firing, so they fire more electrical signals, while the left side will reduce their frequency. When I lean my head to the left, the opposite happens. Now my left side will increase its frequency and the right side will reduce. It seems to be that when you're on a boat or anything that kind of has that rhythmic movement, these populations of neurons can rewire their basic firing. So now when you get off the boat and you're just standing on normal ground, they're still going through this ebb and flow of firing, which means you feel like you're leaning to the right and then leaning to the left, even though you're no longer on the boat. I think most people have probably experienced that to a small degree. We've all been on a boat or maybe even a plane, a bumpy ride on a plane. You get off and you think, oh, I feel a bit, or do you mean, trampoline? You could just spend a lot of time on a trampoline as a kid, and you maybe got off in your first few steps, you think, oh, I feel like I'm still bouncy. And rapidly you should switch back out of that. With the MDDS, some poor souls end up with that chronically. So they, MDS classically would last 30 days, but up to 30 days. But some poor people just have that going on persistently. That's a horrible one, because what you've got is a population of neurons that have now retrained themselves to always do this, and trying to change that again can be very, very challenging. And there's fortunately been some breakthroughs in research on strategies you can use. So it's maybe moving in the right direction of having like a significant plan for it. But in the past, man, it was really, really tough trying to figure out what do you do with these people.
Now, one question you probably tend to get is what causes dizziness or balance disorder to start with if that person doesn't have any trauma, never been to a boat or a plane? So why do they still have it?
So if it's something like vestibular neuritis or labyrinthitis, there are different reasons why it might happen, but the kind of most common is most likely a viral infection. If a viral infection that hits the inner ear, hits the cranial nerve 8, the vestibular cochlear nerve. So if it hits just the vestibular component, like the balance component, we call that vestibular neuritis. If it's both, we call that labyrinthitis, which is why some people say, oh, I was dizzy and I had hearing loss and tinnitus. Whereas some people are like, no, not at all, I just had dizziness. So that probably is the most common one. But yeah, you're right. If they've not had a trauma, they've not had a whiplash, car crash, and let's assume it's not cardiac, that it's coming more from the head, then stress is one of the major ones. Now, the problem with the word stress is we've all learned to associate stress with psychological stress, but it can be anything, right? So a bad night's sleep is a form of stress. Spending all day in the baking sun is a form of stress. An ice bath is effectively stress therapy, right? You're stressing your body and then your body heals in response to that. So sometimes what happens is people can have just these different stresses all mounting up. So they might not say, yeah, it's been awful, my dad died, or yeah, it's been awful, we need a new roof, we can't afford it. Those major stresses are quite obvious. What happened to you? Oh God, life's been awful. Quite often you see people that say like, oh, I don't know, everything's there's a lot of stuff going on. And when you talk to them, it's like, yeah, my kids aren't doing so great. And we've got some unexpected bills, and we've got builders who just seem to be taking much longer than they should, but it's kind of all okay. But they have all these different stresses all adding up. And at some point, the brain wakes up and says, I hate this. So we see quite a lot of people who can't necessarily put their finger on one thing, but you look at their life as a whole. I don't know if you've ever been through a really stressful period, Key, but my system, if I'm going through a stressful period and you say to me how I am, I'm like, yeah, I'm pretty good. Like my default is, yeah, pretty good, handling it well. It's only when it's over that I'm like, oh, man, that was awful. But at the time, how you doing? Yeah, pretty good. Yeah. Bit busy, but no, it's good. It's only afterwards. Or these subconscious cues that you sometimes get, bad night's sleep, waking up frequently. I went through a period of grinding my teeth or waking up literally in a cold sweat. But if you said to me during the day, how are you? Yeah, it's okay. Bit frustrated, but otherwise good. So you often see people like that. There's no one thing you can necessarily say that caused it, but there's probably multifactorial things that add up.
Yeah, and it's just like human behaviors, and it's just like, oh yeah, everything's fine, and you just don't. Rather saying that than explaining like 10,000 things you have at the back of your mind. So
yeah, it's the classic thing. I mean, I don't know what's like in Malaysia, but in the UK, how you doing? Yeah, good. That's your
Yeah.
that's
That's the
the default
classic answer,
answer.
isn't it?
The
Yeah.
world could be collapsing. You're like, yeah, good. Well, good, thanks. Or
Yeah.
not too bad. That's I can't stand that. Not too bad. It's like
You
that's the
can't
most
stop.
depressing answer. Not too bad. Things could be much worse. That's another one. We actually do say that could be worse. What a
Yeah.
depressing way to answer someone rather than just saying,
Mm.
yeah, actually, it's really tough. This is what's going on with me. Instead of, not too bad.
Now, with that said, how do you center yourself then, or reset yourself in terms of you've taken care of everyone? So how do you take care of yourself?
I think you've got to have some time for play. So I think if you've got kids, that's very lucky because the kids naturally want to play. So I think having time to not take life too seriously, and if they want to wrestle, you wrestle. They want to play basketball, you play basketball, or whatever it is, or make believe, or just fully get in with them. I think if you're young kids, you're lucky. You've got this permission to play and make believe and be silly. I think as adults, we tend to at some point decide we're too old for that. I remember having friends at university that university just joyous and silly and playful, and then we left university and it was like they had a personality change overnight. And I remember one literally saying, "Oh no, no, I'm done with that now. Now it's like time to be
Mm.
professional and develop my career." And it's like, oh, okay. Um, so I think for most people, they would call exercise, and exercise is good. But remember, exercise is also a form of stress. So it's undoubtedly good for you, but it's also a form of stress.
Mm.
So if you're doing it and you feel like you did exercise and you feel genuinely great afterwards, awesome. But if you're getting back from that run and you think, oh, I just feel knackered, then all you've done is just add more stress to your stress pile in the first place. Actually, it might be better to say, I'm just going to go for a lovely walk. I'm going to
Mm.
soak in the sounds of the forest or on the beach, or I'm going to, whatever it is. But there needs to be some aspect of, I think, idleness is, particularly in the West, is, if you go to like some of the lovely old Italian villages and you see these old guys sitting out on the stoop having a glass of wine and just watching the day go by, super idle. I think in today's society, we're all super competitive. We're all programmed that you're doing your best every day, Keely, and I know, well, Keely's working really hard. I should work a bit harder. And oh, Tom's
Mm.
doing really great. And we're all so interconnected. And the world of social media is telling us you got to do more and work harder and be fitter. I'm turning 40 now, and I'm very aware now that so many friends have become, posting every single day their gym videos, and they're thinking like there's this competitive of like, I can age better, I can be hotter for longer, that kind of thing. I think all it's doing is adding more stress to the system. And actually, we all do quite well. We said, actually, it's quite good just to have some idleness, go for a lovely walk, soak that up, move, feel good, play, and not have such pressure to look perfect and
Mm.
behave perfectly the whole time. I think kids are
Mm.
good for that. They let you kind of shake that off.
I mean, that's very much needed in this society where everyone is, your highlight reels is in your social media. So you're just comparing with people's best chapter instead of what happened last night. So,
Yeah, I've become a real grump about it now. I think the more someone posts about their gym session or their amazing holiday, the more I'm like, probably covering up for all the other crap you're having to deal
oh,
with. Like, I'm let you have your moment. That's lovely. I'm glad you've done this thing. Fantastic. But there's no need for me to
mm,
feel competitive with that. I don't know what
mm,
else is going on. You could have a whole load of reasons what's going on in
yeah,
the background. So
exactly. How old are the kids now? I know it's been a long time since I've seen you.
yeah, they have grown a lot. So 7 and 5. So yeah, awesome age. Smart enough and intelligent enough to be able to do some stuff for themselves, and but still playful and yeah.
Like, how do you balance the time between working because you're doing so many things, you're teaching and flying all around, and then how do you like make time for family and actually build bonding time with them?
Yeah, my work days are intense. So from 9 till 6:30, there's basically no gaps, and it's go go go. But very simply, once you're done, you got to just turn it all off, right? So computer goes in
Mm.
sleep mode, phone goes down. You're not looking at your phone, looking at emails. As you found, Kia, you sent me a text message on
Oh
Saturday, and I
yeah,
was rubbish and didn't get back to you at all.
not
So
at all.
it's
That's good
it's
though.
things like, yeah, I think it's things like that. You have to be fairly firm. So when you're working, you're working. When you're not working, you're not. So that I have not done it on my phone, but I think there is a lot of value at removing any emails from your phone. So as you saw, I'm not great at I'm not great at being like, oh, Kitty, I'll get back to you on Monday, and then obviously Monday comes and I see the other list of things. But yeah, I think you just have to be very strict with yourself. You got to remember these things are designed. Our phones are designed to be super addictive, right? And they have mastered that. They've got some of the world's most brilliant people trying to make these things as engaging as possible. So I think the best thing you can do actually is get used to and be comfortable leaving your phone in another room. So put it on silent. It should be on silent. So as soon as you're done with work, it's on silent. And then if you're comfortable and it's reasonable, you're not got elderly parents who might need you or something like that, but you leave it in another room and be prepared to leave it there for a few hours. I won't say I'm perfectly that. No, me and my wife aren't perfectly that at all. But when you're with the kids or you're with friends, right? You shouldn't be thinking, oh, I wonder if there's something more interesting on that phone.
Just being present in the moment, isn't it?
Yeah, absolutely. Nothing groundbreaking, nothing revolutionary, just, but hard to practice, I think. Hard to practice.
Well, exactly, isn't it? Now, with what you know now, what what would you advise younger Jake?
That's a good question. I think I would have advised me to start on my own sooner. I think I had a bit of insecurity that I could make a clinic work by myself. And so I think I waited too long. I think if I started again now, I think I would advise if you're working with a clinic or whoever and you've got a great setup, fantastic. Don't underestimate. I think the other thing I kind of didn't fully respect is when you're working for someone else, just how much work they're doing behind the scene that you don't see. So you kind of turn up, treat your patients, leave, and then get grumpy they're taking a percentage. But what you're not seeing is behind the scene is it's like the swan on the water, right? You see the gracefulness on top of the water and underneath their feet paddling away. And I think that's like when you work with someone else. So I think I had a bit of insecurity that I couldn't do it myself. So I probably waited too long. And when I did, I was like, oh, this is the best. I wish I'd done this ages ago. But it's not for everyone. You're definitely going to work more. You're definitely work longer hours. There's definitely more pressure and more stress. And, I remember thinking now I'm like, I never used to answer emails. Like emails just weren't a big part of my day. There was some, it was like a few emails a day. Whereas now I'm like, wow, yeah, so just a never-ending waterfall of emails. So yeah, I think I would tell myself to have stride out and gone for it sooner. But I think I was quite lucky that I've always studied, and I think I'm very pleased that I think I took the advantages when I had the chance. So there's not much I would change really.
What gave you the push then when you said that you waited a little bit longer, but what ultimately pushed you to start your own?
Just the commuting is just so soul destroying.
Right. That's to London, isn't it? So I don't know.
Yeah, exactly. So just the M25, you didn't know it was going to be a half an hour journey or an hour and a half. And after doing that for 6 months, I was like, this is horrendous. I'm done.
Right. What sort of books and resources do you would share to the audience, the listeners, or even students that wants to be someone like you?
I don't know. I like anything on psychology. There's a book I loved called Humankind, but it's one title that jumps out of my mind. It's I think there's a lot of negativity and pessimism and this view that most people are bad and looking to rob and steal from you and to take advantage. And actually, the vast majority of the world are good, kind, thoughtful people. And that book Humankind is a wonderful kind of evidence-based look at that. So I thought that was a wonderful book. That's probably one of the books that I wish more people would read. And then I think there's a lot of value in having reading very widely. So I think if you come to my house or you look at my kind of Audible selections, they're all over the place. I think I like looking at mental models. So anything to do with like how to think better and how to problem solve better. I won't pretend I use them all the time. I spend all day like some kind of CEO of one of these tech companies, like analyzing everything. I think it's fascinating looking at these mental models. So I think that'd be something that we could all do better. In terms of studying, just learn how to read research papers. I think too much weight is given to social media. I think there are so many people who it's just remember that social media is business, right? So people are just trying to flog anything. So you have someone who says, I just read this paper. They've not read the paper. They've read the abstracts. They've seen someone else post a video about it. They're just reposting that information. I think for other clinicians and even in patients now, AI is here. You can just get used to learning to search for papers, you just put it into AI and just say, is this good quality? And AI is pretty good at now at saying, no, it's rubbish, or here's its limitations.
Yes.
So just get good at finding papers, ask AI, ideally do it yourself, otherwise you'll lose the skill, but either appraise it yourself, ask AI to appraise it, and then get used to reading that information, because that's where the real information is. The world of social media is full of such nonsense. So I think that's the one thing. I think it'd be great if we were all just fluent in reading in actual quality research and understanding, is it a good paper? Does it really reflect things, or is it full of bias? We all have our own biases. So yeah.
It's more in discerning whether that's right or wrong, isn't it? So we're coming towards the end of our conversation. I know we just started and we can go hours and hours on this topic. Where would be the best place to find you then, Jake?
Oh, thank you. So my clinic is the Neuromuscular Clinic. We're in Surrey in the UK. But for people who are dizzy, we have an app called Well Balanced. So it's well-balanced. You can find it on the app stores for Google and Android. You can find it on the website. So for dizzy people, that's the best resource. It's free to download. There's a week of free vestibular rehab. And if you need more help, there's a longer course available tailored to you. So yeah, you can reach out to us at either of those channels if you'd like to.
That's perfect. Then I'll write all your informations into the description below. So if anyone is struggling with dizziness, they can reach out to you and use your apps and also all the other information you have in your website. Before we stop recording, what will be one phrase or one sentence you'll leave to the listeners?
Oh, that's hard. I mean, that could be it. uh, so yeah, I would. I mean, it's going to sound super cheesy, but I think if we could all just be curious, be resourceful, and be thankful. I think those are probably three things that I'm trying to instill in the kids. They could just be more curious about how do things work, why they work. Be resourceful. Probably things are actually easier than you think. The answer is there. You just need to try and see it. And my goodness, don't we have everything we could possibly want? So just be thankful for it.
Amazing. That's such a great way to end the conversation. Thank you so much, Jake, for your time. We'll look forward to speak with you again soon. And if anyone is interested to speak with Jake, you can just search him up and he'll be happy to help with things there.
Great. Thanks so much for having me, Kitty. Pleasure being to you.
Thank you for tuning in to the Life of Being podcast. Let us know what is your one key takeaway from this episode. And if this conversation inspired you, share it with a friend who might find it helpful today. Until next time, take care of your health and take care of your being.